Well, just this week, California Governor Gavin Newsom released a master plan to combat the fentanyl and opioid crisis, and Newsom is directing the National Guard as well as the California Highway Patrol to help crack down on fentanyl in the state. California also looking to manufacture its own naloxone. That's the opioid reversal drug. One of the things Newsom's plans to do with an additional $96 million in funding. And of that $3.5 million will go towards providing the overdose medication to all middle and high schools. Joining us now, Associate Professor at the Johns Hopkins University School of Medicine, Dr. Paul Christo. Dr. Christo, thank you for being here.
My pleasure. Thanks for having me.
How unprecedented is it for the National Guard to be called in to help crack down on the fentanyl crisis? And what are your thoughts when you heard this?
Oh, I mean, very, very unprecedented. But, you know, we're in unprecedented times. Gosh, just last year, there were over 100,000 overdose deaths. More than 60% of those are due to the illicit drug called fentanyl. And this is being, perpetuated throughout the entire country, not just California, but I think California is bearing the brunt of this, especially San Francisco. They've had like a 40% increase in fentanyl overdose deaths during the last several months.
It is incredibly concerning. And in response to the governor's actions and statement, we know that San Francisco public defender is saying, quote, no amount of law enforcement will solve what is really a public health crisis. What are your thoughts on that?
I think that's partly true, but I also think that we need greater law enforcement at the border. For example, between Mexico, California, Mexico, Arizona, we know a lot of the drug trafficking is occurring there. And I think we really need, for the public safety, to have much greater, basically police presence at the border to prevent the flow of illegal fentanyl to California and to other states as well.
I want to get your take on Tranq, because we know the U.S. labeling it an emerging threat just recently. And xylazine is a veterinary tranquilizer. It's meant for large animals like cattle. We're now seeing it cut into fentanyl. And at first, as a network, we've been tracking it in places like Philadelphia. And we've seen it spread, now detected in 48 states so far. What are you tracking here? How concerned are you? And especially about withdrawals being different from fentanyl when it comes to Tranq. And is there a medical will to be able to treat those withdrawals specifically at this point?
Yeah, so this is a major danger. Tranq, xylazine is the medical name for this, is a veterinary tranquilizer. As you mentioned, it's a muscle relaxant. It's an analgesic, which means it's a pain reliever. It's used for animals. It's not for human use. Yet what we're seeing is those that are using fentanyl illegally, injecting it especially, are also injecting this drug called Tranq. The reason is that together they lengthen the euphoric effects of the fentanyl, but it makes it even deadlier. Fentanyl in and of itself, when used illegally, can be very, very deadly. As we've seen, it suppresses respiration very quickly and leads to death. On top of that, if you're using Tranq, no question that's going to lead to death very quickly. And you can't use Narcan, the opioid reversal agent, to reverse Tranq.
It's incredibly alarming, and it's a big topic. I wish we had more time, but I really appreciate the insights you've provided tonight. Dr. Paul Christo, thank you so much.
My pleasure. Thanks for having me.
Okay. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.